Hey everyone, hope you're doing well. Today I want to talk about inflammation. This is such a big topic when it comes to PCOS. I'm actually waiting for Costco to open. I got here early so that I could get some flowers for my mom because it's Mother's Day this weekend. And I'm really excited to talk about inflammation because this topic came up in my practice this week, and we're talking about what are some forms of inflammation that could be present that are showing up in your body. And you might not think like you have inflammation, but there's so many forms of inflammation, and I want to kind of talk to you about that today and then tell you a little bit about what you can do when it comes to inflammation. So first and foremost, when we talk about inflammation, anything that's related to pain is inflammation. So joint pain, back pain, period pain, this is all inflammation, because what we're making is something called cytokines. These are chemical messengers that cause the body to experience pain. So another form of inflammation is any redness you see in the body. So acne, you know, when you get like this red, I actually have one right here that I'm showing you, red acne, inflammation, this is a scar actually, or even a patient this week was complaining about like bumps on her scalp that are red. So that's another form of inflammation. Dandruff, you know, even eczema is a huge form of inflammation. You know, that red, dry, flaky skin. So really trying to see where inflammation can come in that way. Another form of inflammation is stress. A lot of people don't think about this one, but it's actually a huge source of inflammation for a lot of people. And so we want to try to figure out, how do we reduce inflammation in the body? The number one thing that we can do to reduce inflammation in the body is working right at the gut, because that's where everything enters into the body. Every single thing that we need in our body to work and survive we get it from our gut, from what we eat. So obviously, the number one thing we want to do is reduce all inflammatory foods if there's lots of inflammation in the body. So I know you probably know what I'm going to get to next, but sugar is probably the most inflammatory food, obviously, we have on anything that we have in terms of food. So reducing inflammation through reduction in sugar is so important. And so when you do that, you'll notice inflammation come down so quickly. And then another form of, biggest inflammatory foods we have, especially in this country where I live, is Canada, is, dairy and gluten. And so a lot of people that I work with, including myself experiencing this, is removing dairy and gluten. I found that my inflammation came down significantly. Less bloating, less inflammation in my skin, water retention, all of these things like actually really improved really quickly. Pain in the abdomen. Sometimes I would wake up with like abdominal pain, and I didn't know why at the very beginning when I was diagnosed with PCOS. And removing dairy made a huge difference in my way of living, and just lots of pain reduction, which was so significant for me, such a life-changing experience. So if you're experiencing any of these symptoms, pain, inflammation through stress, inflammation through, all forms that we're seeing in our skin, in our gut, pain anywhere in the body, try to reduce these inflammatory foods and see what happens for you. When it comes to supplements, there's a few supplements that I really like when it comes to inflammation. First and foremost, when we're thinking about inflammation, we're thinking about antioxidants. So Anicalcysteine is probably one of the greatest antioxidants we have when it comes to PCOS, because it was initially studied for bronchitis, but recently has been studied for reproductive conditions like PCOS and endometriosis. This antioxidant is a precursor to glutathione, one of our most important antioxidants in the body. And it really helps reduce inflammation in the skin because it helps to reduce testosterone. It also helps to reduce insulin. It even helps the liver detoxify. So if I'm thinking about one antioxidant, I know there's so many other things you can do, omega-3 fish oils, vitamin D, antioxidants like vitamin A, C, E, selenium, and zinc. Like all of these are really great antioxidants. But when I'm thinking about PCOS specifically, I'm thinking about what's the one antioxidant we can use that will help global global symptoms when it comes to PCOS, and N-acetylcysteine is the one I would be thinking about. Research tells us that 900 milligrams twice daily is the dose in the research, but always speak to your healthcare provider before starting N-acetylcysteine, just in case there's any interactions with any supplements or any medications that you're taking. Now, what's really cool about N-acetylcysteine is that you'll notice it'll take some time, but definitely, consider it, talk to your healthcare provider, and let me know what you think. If you have any questions at all about inflammation, please drop them in the comments below. I'm going to post a link to my online course. It's called Your PCOS Planner. We talk all about supplements in this course, research backed, what we're doing in terms of, reducing inflammation. There's a whole section on inflammation in Your PCOS Planner. So if you want to learn more about it, I'll post a link below in the comments, and I'll see you in the next video. Happy Friday.